Frequency Podcast Network. Stories that matter, podcasts that resonate.
Safe to say, U.S. Health and Human Services Secretary Robert F. Kennedy Jr. is still in the spotlight. There are still calls for his resignation from both sides of the political aisle and from members of his own family. Talk about that started picking up steam after a 3-hour intense grilling by both Democrats and Republicans at the Senate Finance Committee last week. Now, Kennedy spent part of his time trying to justify some of his decisions, including the call to fire several members of the Centers for Disease Control.
We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year.
The White House and U.S. President Donald Trump have continued to defend Kennedy.
He's a different kind of a guy. He's got a lot of good ideas, but he's got a lot of ideas. You know, normally they don't have any ideas, and that's why we have problems with autism and so many other things, because we're coming up with the answers for autism. You watch. We're coming up with the answers for other things that normal people, regular people, easy to get along with people wouldn't be able to do.
And yes, all of this is happening in the U.S., but doctors and scientists on this side of the border are concerned about what it means for Canada. I'm Kris McCusker, and in this episode of The Big Story, we look at the potential Canadian consequences from some of RFK Jr.'s decisions. Joining us is Dr. Kashif Pirzada, a Toronto-based emergency physician and co-chair of the Canadian COVID Society. Thanks for doing this.
Well, thank you.
So, did you watch the hearing with RFK Jr., and what were your thoughts?
I watched it and I was honestly horrified watching it. I was happy that there were some Republican senators that pushed back on it, but it is incredible that we are seeing such an official with so much power in the position that he's in right now.
And this is kind of part of the overarching theme. Like, this just solidified what many had already believed in the way Kennedy was handling this role as HHS secretary. Fair?
Fair. Like, I think, he stated that he would focus on health and, supplements, like, environmental toxins. And he's gone straight for what everyone in the medical field knew he would do. He would go straight for childhood vaccinations. And that's the horrifying reality now that we're living with. And I think the Republican senators that contributed to confirming him are realizing that right now.
Because it was no secret. I mean, he has long been a vaccine skeptic. But now that he's in a position of power, I think there are obvious concerns about how this could stymie any progress around vaccines or any funding to research vaccines.
100%. Like, he's already thrown a spanner into the works of the fall flu and COVID vaccination program. So, we should be seeing, vaccines rolled out in pharmacies across the United States, easily accessible. But now there's a lot of confusion on whether a doctor's note is needed, which pharmacies have it, are they allowed to give it? So states have taken it on their own, especially in the Northeast and in the West Coast, to initiate their own guidelines. So it's pretty extraordinary what the amount of damage he's done in such a short amount of time.
Well, and again, we have to remember, I mean, you're joining us as a member of the Canadian COVID Society, but we're not just talking COVID vaccines. We've had an uptick in measles cases because maybe measles vaccines are not being used as frequently as they used to because there is some doubt around that, when in actual fact and reality, and doctor, please correct me if I'm wrong, the measles vaccine is one of the most effective.
Oh, 100%. Like, measles vaccination, widespread measles vaccination has put this killer of children under control. I think the sad thing is that we've collectively forgotten what the pre-vaccine era was like. We're 1 or 2 generations removed from that era when parents thought it was a miracle from God that these vaccines came, that diseases like polio wouldn't cripple their children, measles wouldn't kill their children in their beds. And now, what we're facing with, we had a huge outbreak in Ontario, which is just slowing down now. There's a huge outbreak in Texas of measles with 2 deaths in young children. So, vaccinations are that essential bulwark, and they're being undermined by RFK Jr. in this way. I'll give you an example. So we had in, let's say in Thornhill, Ontario, there was 4 reported cases of measles. Was that going to break out and cause a huge outbreak? Probably not. It's going to hit a brick wall of immunization and vaccination immunity, and it won't spread anywhere from that. But can we say that 10, 20 years from now? Can we say that a little outbreak here will stay contained in that area? We have an incredibly safe and incredibly effective vaccine that gives lifelong immunity for measles, and I just can't believe that we're back to the stage of undermining that.
And the other thing that I find so fascinating, I mean, you're right. There are generations before us that, would look at this and think it was ridiculous. There are also countries that, like, we have access. I shouldn't say we. The U.S. has access to the vaccines, and they're opting to not use them. There are countries that would like to use them but don't have the access.
It's incredible. Like even my own family history, like my grandmother in the old country died of tetanus, a vaccine preventable illness. My parents had siblings who never made it out of childhood because of what are now completely vaccine preventable illnesses. Like the living memory is there. It's just fading for a lot of people, and they don't remember how terrifying these things were. My family doctor died of meningitis when I was 6. I had to take these funny pills to prevent me and the family members from getting it. And now we have a vaccine for meningitis, several vaccines for them that we give out now. So we have avoided so much death. Like there's one estimate from the WHO, like since 74, probably 150 million lives were saved since just 1974 with vaccines. Each life saved lived another 60 years. So that's billions of life years that were added because of vaccines. If you look at modern medicine in general, like doctors get a lot of credit for really 2 inventions, like antibiotics and vaccines. That really turned the tide on illnesses at the beginning of the 20th century. And we're in the middle of undermining this immense discovery, this immense tool.
Now, the thing is, there are lots of people that might look at this and say, you know what? That's the U.S. I live in Canada. Not a problem. But it is a problem.
Exactly. Like we have a rise in the anti-vaccine sentiment here as well. One thing that is unique about Canada is that, we are a nation that has evolved with the need, winter is every Canadian's original enemy. So winter has sort of made us a nation of people who like to work together to solve big problems. We saw that with the COVID pandemic. We had 1/3 of the death rate of the Americans, even though we have a similar culture and language as them. But even this kind of thinking is making its way here. You see it in modern rhetoric that just comes from, the convoy movement and other movements, that this individualistic, you can't impose anything on me. I can do whatever I want. I can send my kid with measles into the classroom and infect any kid I want. And that kind of attitude is becoming more prevalent here, I think, from influence coming from the South.
Well, and not only that, Americans come up here for vacation or for other things that, there are probably many Americans here now in Toronto for TIFF. So, they're in theory potentially bringing illnesses with them.
Exactly, like stuff that we're just not used to seeing. Like if you look at what's happening in Florida, so Florida is removing vaccination mandates for school children. So I'll predict, I'll go on a limb here and say, in 3 to 4 years, when a whole cohort of kids are hitting public school without measles vaccination or other vaccinations, Disney World will be a dangerous place to go for a lot of Canadians. You'll have outbreaks upon outbreaks at that point. And the sad thing is, you can't even vaccinate children less than 12 months for measles. So that's a whole 12 months where they're vulnerable to it. Are we supposed to just lock our newborns up at home all the time because some people just can't understand science and want to spread this disease everywhere? It's incredible.
Do you see, in your day-to-day job, do you deal with people and, try to straighten out any misinformation or do any myth busting? Like, do you actually come across this?
Thankfully in Canada, it's very rare to run into this individual. I actually ran into it twice, and it was actually the same person, 4 years apart in my hospital. So I think it's it's very rare. Like I've in general, I don't think you'll be able to convince people, but you can try to sort of chip away and try to get people to look at the welfare of their children first. We're blessed in the big cities that we have very high vaccination rates. Our outbreak in southwestern Ontario is mostly focused on, small religious communities. So, we're very blessed that we have that consensus here. I just hate to see movements that undermine it. I feel like they are growing, but I think, overall, we're a very rational people.
How would you consider combating those sorts of practices? Or how do you fight the misinformation?
So I think the main way to address it is just addressing the core of their argument. So there's a lot of distrust of institutions exhibited by, this organized anti-vaccine movement. And I think they decry, mass media, into the universities, academics, but really they start trusting their own institutions, like this network of these shady podcasts, other alternative news media that are just alternative institutions that are more corrupted. The other thing we can do is point out the conflicts of interest that a lot of these figures have. Like they will decry and criticize vaccines, but they're selling supplements and vitamins or their miracle cures. We saw that with the ivermectin during the COVID pandemic. And I think overall, we need to just circle back to the science of things. Like we, go to, peer-reviewed research, verified trials. And, there's over 500 trials just going over vaccines and their safety so far. So I think, pointing out the hypocrisy that people like RFK Jr. are presenting, debunking some of the obvious lies that they spread in the media space, and also pointing out that science is on the side of vaccinations and modern health innovations.
RFK Jr. is set to release a report this month that points to Tylenol as the cause of autism. So pregnant women using Tylenol. Just out of curiosity, have you seen anything to support that? Is there any chatter? Have you heard anecdotal evidence even about that?
No, honestly, I've not until this week, until it came up in the news. So, I think the Maha movement, quote unquote, I think, there are some real concerns about chronic disease that they bring up. But really, we all know what the real drivers of chronic disease are. It's poor diet, lack of exercise, poverty, things like that. When they're pointing to things like Tylenol, to me, it looks like it's desperation. He tried to point at aluminum and mercury, but there were massive studies that came out recently that showed no link to autism with those. So I think basically RFK Jr. is grasping at straws. He's going to try to paint all kinds of things as facts. I think, there was some studies with a hint of a signal about Tylenol, but then there was a massive study in 2024 from Sweden involving 2 million children that didn't show any link of Tylenol and autism. And that's even comparing siblings who had Tylenol in utero and who didn't. And the other thing is, if you're pregnant, no other painkiller is approved to be used except Tylenol. You can't take Advil, you can't take aspirin, you can't take any anti-inflammatory, you can't take morphine, you can't take anything except Tylenol. So if we take Tylenol off the plate, I don't know what we're going to give pregnant patients for pain.
And I mean, it sort of puts a dangerous narrative out there too, because then it's for women who maybe did use Tylenol during pregnancies, it's like, oh no, maybe this is my fault.
Oh, exactly. And I think it goes back to old Victorian tropes, maybe because I didn't think the right thoughts, I gave my baby something. It's incredibly sexist as well to try to keep putting blame onto mothers and women for something that is completely out of their control. And I think, it points to some of the way of thinking of these folks. Like if, God forbid, a child dies of measles, they'll say, oh, he didn't have the right vitamins, or he had a pre-existing condition, or maybe they weren't healthy. It's a very sick level of thinking here. The other thing we need to point out is that RFK Jr. is an inveterate and very basically a pathologic liar when it comes to a lot of things. And engaging in debate with him and others figures like him is impossible because they just lie constantly. One time he had to submit rebuttal to a study. It was basically obviously generated by ChatGPT with made up references, made up by ChatGPT. But the doubt is sown in people's heads that, oh, there's an argument against this and that. Like, maybe we should pay attention. This is how they introduce fear, uncertainty, and doubt. It looks like a debate when you debate someone like that, but it's actually just platforms, more lies, and misrepresentation.
But do you think, like, what do you think is the goal of muddying the waters, so to speak? Like, does he actually think that he has all the answers, or like, do you think he's just trying to cast doubt in the institutions like the CDC or other organizations in the U.S.?
I think there is a lot of suspicion of institutions these days. Maybe it's just the current times we're living in. We've lived in a lot of upheaval in the last 5 years. The pandemic, a lot of wars happening across the world, economic problems. So I think there is a well of discontent that is being channeled to overall discontent with institutions, and that's what he's building on. And I think, if you don't have a good science education, if you don't understand the basics, it's easy to get swayed by people who claim to offer answers. In medicine, like, we often, when I'm seeing patients, I don't tell people I know something that's 100% true. Like, I know why 100% you have this condition. We always hedge because we don't know 100% certainty about anything. But when someone comes to you and says they have all the answers, they know everything 100%, I would always be suspicious of that individual. No medical practitioner would ever make that kind of claim.
Well, and I mean, in fairness, I guess, as you've just touched on, at the beginning of COVID, there were a lot of things about COVID, like, is it airborne? Is it not airborne? And there were different directives coming. I remember Dr. Fauci getting up there and the narrative was changing, but I understood it was because we didn't know. This is a new virus and nobody knew. So it almost feels like some Republicans in the US kind of jumped on that not knowing as an opportunity to cast doubt.
Exactly. Like, and I think it raised that doubt in people's minds. Like, at the beginning, we were still trying to figure out basic things. Like, we knew, like, SARS-1 was airborne, but for some reason that knowledge didn't filter out to SARS-2, and that led to a lot of the problems. We had, 6-foot distancing, which really didn't have any basis in science, where we probably should have just worked on improving, indoor filtration, air filters, and masks. So that stuff came out with time. There was also a lot of claims that the vaccine would stop everything completely and that would stop transmission, but that it's ended up being more effective at preventing severe disease. So a lot of people took that as a way. A lot of people lost faith in institutional science from that pandemic, unfortunately.
And you have heard stories about what it was like working in hospitals before vaccines.
So I have colleagues who worked, older colleagues who some of them retired, and they used to tell me stories of what it was like to work in the pediatric wards in the 60s and 70s before vaccination became universal, or before some of the ones that we have now. And it was obviously, it was incredibly terrifying. You would have children dying all the time from various diseases, and that is well behind us now. Like, a modern medical graduate wouldn't even recognize a lot of these diseases. I just can't believe we would throw away so much progress for no reason except, I don't know what it is, just boredom, I guess. But we live in such a blessed time to have these tools available to us, and we should not throw them away.
Canada also has a solid history around vaccines.
So Canada played a huge role in the elimination of smallpox. It was freeze-dried vaccine from Connaught Labs in Ontario, the hundreds of millions of doses that went all over the world to help eradicate smallpox. So we have, some of the the best experience with vaccinations in Canada, eliminating a disease that used to kill 30% of people it infected. So we have a long and storied history in Canada of being behind vaccines and supporting them and eliminating disease with them.
I'm also curious, there was this hearing for RFK Jr. and I feel like there were probably a lot of doctors paying close attention. Like, you have this Canadian COVID Society as an example, but are you Canadian doctors collectively at a group as a group sort of watching what's going on with the U.S. and, talking to each other about how to combat it or what to do to sort of make sure that Canada doesn't fall into some of the U.S. narrative? Like, I'm just curious if professionals are discussing amongst yourselves the concerns.
There's so much news coming out of the U.S. these days. It's hard to really know what to plan or think. I don't think we've collectively measured the risk of this happening in Canada. Like, I just hope we maintain some level of sanity here. There's no hint from our professional societies or from public health officials that they would follow in the footsteps. There would be quite a vicious pushback from medical practitioners across the country. So I don't think it would happen here, but I think it is a good idea that we start discussing it. Like, it's not impossible that we might have a public official try to go crazy on this issue. We have, in a minor form in Alberta, the restriction of access to COVID vaccinations. So that is like a foothold in Canada so far. But I do think, I think you're right. We have to start discussing it as a profession.
Well, thank you so much. I appreciate you taking the time to break all of this down with us and clear up some of the misconceptions coming out of the U.S. I appreciate it.
No, thank you. And I hope our American cousins, family members, and friends find their way through the next few years.
That's Dr. Kashif Pirzada, a Toronto-based emergency physician. And that wraps up this episode of The Big Story. You can send us feedback on this or any other episode at hello@thebigstorypodcast.ca. I'm Kris McCusker. Thanks for listening.